Medicine at the University of Santo Tomas, Faculty of Medicine and Surgery. He took further training in family and community medicine in Hospital ng Maynila Medical Center. He is a diplomate and fellow of the Philippine Academy of Family Physicians. He holds a master's degree in management, major in hospital administration. He is also an active member of the Philippine College of Geriatric Medicine, Philippine Society of the Aging Male, Philippine Medical Association, and UST Medical Alumni Association. He is currently the Vice Chairman of the Outpatient Department of Hospital ng Maynila and an active consultant and Vice Chairman of Family Medicine, Hospital ng Maynila Medical Center. Currently, he holds his private practice in CRFM Clinic and Diagnostic Center in Mandaluyong City. He is a loving husband to our dearest momsy, Dr. Cecilia De Castro, and a proud daddy of his tres Marias. Let us welcome Dr. Jose Paulo De Castro.
Thank you very much, Regine, for this kind introduction. There is a saying, good things come to those who wait, and we are indeed lucky that we saved the best for last. It is an honor and privilege to introduce and be the moderator for the next speaker. Our speaker is one of the strongest advocates of healthy lifestyle and traditional and alternative healthcare. He is a graduate of Doctor of Medicine at the University of Santo Tomas, Faculty of Medicine and Surgery. He took further studies in Masters in Developmental Management at the Asian Institute of Management and further studies in Herbal Medicine Clinical Research at the Tel Aviv. He is a consultant at the Department of Family and Community Medicine, that is a physician and acupuncturist medical center, acupuncture and wellness clinic, and also a consultant at the Quirino Memorial Medical Center. To talk on the topic, global wellness beyond the COVID-19 pandemic, opportunities for the primary care physician, a community-based early diagnosis, acupuncture, and healthy lifestyle coaching. Colleagues, let us all give a warm welcome to Dr. Alfonso Lagaya.
Thank you very much, Dr. Paulo, to Dr. Alisa Calderon, to the team of Manila Medicine who made this postgraduate course possible, to the NMPC technical staff. I'd like to greet each and every one of you a pleasant afternoon. So all this time, we have been listening about this unalome. So as a physician, let's focus more only on the aspect of as a physician and having enlightenment. So next slide, please. I hope to cover up the following. So unalome for a primary care physician, and then all of us are already aware of the current healthcare system in the Philippines. As a former Director General of the Department of Health, PTAC, we were able to look into the general scenario of the Philippines and what are the advantages and disadvantages of our current healthcare system to the challenges that we are being encountering now. So what's also the significance of community-based approach to healthcare? We all know yung gasgas na salitang prevention is better than cure. But who really is following it? And we will discuss such approach as a physician now and how we do it to the Philippines and the clinic that we are handling. Of course, we have the global wellness trend. We will be talking about wellness, but is there really a market to such? Would we be able to really come out with that global wellness trend? Shall we get into it or shall we set it aside? This lecture, this sharing that I will going to give to you shall focus more on that thing as what is the global trend and our role as an integrative medicine doctor. We are a Western trained doctor. Shall we come out with an Oriental approach? and come out with an overall wellness? Will it be applicable to the current scenario beyond 2022? Then, of course, we have this community-based early diagnosis and acupuncture, which I expect that we would be able to share to the audience right now. How would you be able to do acupressure diagnostically your patient so that you'd be able to integrate this to your professional approach too? We hope to come out with a demo and return demo. So we are now here at Hospital of Maynila to have a video presentation of these things. Acupoint location and its correlation to what you will diagnose in your patients. Today, you can start with yourself. Then later on, you can try it to your loved ones back home, right there. Expand it to your clinic, expand it to the patients, and then you can already integrate everything that we do diagnostically and therapeutic into such patients. But again, how do we entice patients to react? We all know about healthy lifestyle, specifically everything about healthy lifestyle, specifically about Oriental approach, but who is going to follow it unless you entice them to see that their hair is on fire, literally and figuratively. So next slide, please. So next slide, please. So the theme of the, yes, next. There's prior to it. Okay, so Unalome for the primary healthcare physician. The target audience that I wish to address to would be all of us, general practitioners, and of course the specialists. Now, among family medicine doctors, it could be company physicians, it could be HMO doctors, it could also be the holistic and integrative medicine practitioners, and also into the wellness physicians here. Now, if you are a medical specialist right now, the one who is viewing, are you an internist? Are you a surgeon? Are you a pedia? Are you an OBGYN? I was talking to one OBGYN classmate of mine, and we were looking at how to integrate such approach to her practice. Okay, next slide, please. So next slide. So here, we've been hearing about Unalome from day 1. Today is the day 4. So what does it really mean? What is journey to enlightenment? If you going to do Google search, it will represent a person's journey through life toward the ultimate freedom of mental clarity and enlightenment. How do we attain it? It is a visual metaphor for working through human entanglements to the path of spiritual fulfillment. I will not get much into the spiritual aspect of it. Baka mas marami pa kayong alam dyan. But what role would it have for a healthcare physician? Next slide, please. So there is a symbol as what you will see in the logo that we are spreading out. There is that symbol, and what does it mean? And we will break it down into chaos, wherein there is a realization of what is happening to our patients, to a particular disease. There will be errors learned, and that is where the veteran doctors would come in. And we all know that's the like of Dr. Samaniego, the like of Dr. Quaresma, Dr. Relaya. They would have been in practice a long time. And since we in the faculty team, that does not necessarily mean that we know more than our students. It is the role that we had more experiences due to the mistakes we've earned. And those mistakes, what we are now re-echoing to our students so that we'd be able to make them as better as how we have attained it. And they call it as transition to nirvana. Then we get into human maturation, or the nirvana itself, and then enlightenment. Okay, next slide. So chaos can be represented by disease, disability, and death. The triple D. And the awareness of it started with now us. We graduated into our medical school, which was preceded by our pre-med courses, which has been there also with folkloric beliefs and practices. However, we would like to focus on evidence-based medicine to consider these folkloric beliefs practices. Now, I said medical specialists are the audience we have right now, and then the physician's approach to healing, and the journey to a healthcare enlightenment. Next slide, please. So actually, it's a Buddhist term, but some practitioners of Buddhism claim that Buddhism is not a religion. So it's okay for us, whether we are a Christian, we are a Catholic, we are a Hindu, we can always attain that enlightenment later on. Next slide, please. So after encountering that disease, disability, and death, all the 4 days of our seminar here, this postgraduate tried to enlighten us on how they did it, how the speakers with all their experience did it, and how we learned much from it. Next slide, please. So let me just focus on the very basic thing that we as doctors are doing. I was listening to the good lecture of Dr. Wong, and I was amazed at how he was able to break down the issues of this NAFLD. And it's nice to see that if it's non-alcoholic fatty liver disease or the metabolic associated fatty liver disease, we break it down into us being a doctor and try to diagnose and treat the patient. So anatomically, he was talking about ultrasound, and also for the histological approach of it, that is the biostructural anatomical responses of a tissue under injury. But prior to that structural damage, it will start first with biochemistry, and our ALT, AST will already come out with an increase in the substance that our laboratory reagents would be able to identify. But what is bioelectric? Bioelectric is the start of everything from the gross level of how we manage a patient. We are aware of the ECG, we are aware of the EMG, we are aware of the EEG. Now, looking at a particular cell, it has a charge. Actually, it's 25 to 55 joules. So if you're within that range, no injury will happen to our patient. However, if there's too much injury happening, particularly related to lifestyle, so when they're talking about NAFLD, non-alcoholic fatty liver disease, was there an issue regarding it being challenged, the liver as such to such? Next slide, please. So we attain wellness by being aware of such bioelectric, biochemistry, and biostructural thing. If we violate it, next slide, we would now risk that disease, disability, and death. So what is this biological response? Has something to do with the onalome that we are discussing. Next slide, please. And this is where I would put it in. Next slide, please. So here you would see that there is the bioenergy and then the biological response. And it is where the interface would come in. So we know we have our knowledge, we have our books, we have our postgraduate courses to focus on it. But of course, as Christians, as Buddhists, as a Muslim, as all the practitioners, we are always praying. We started with this day and all the other days with a prayer. I always challenge my postgraduate medical interns, why do we pray prior to a class? What is the evidence-based, the scientific basis of prayer? Of course, the veteran doctors now are aware of how prayers are really that active, but is there really a evidence-based? It is this spiritual and divine or self-consciousness that triggers the bioelectric that comes in place. But of course, this interface has to be guided on. Next slide, please. And who is guiding us? In Oriental medicine, we have the typical yin and yang. Next slide. However, we also are aware with a lot of practices from the Christians, from the Catholic, the born again, the Protestant, from the Muslim, from the Hindu, from the Jewish, all of it will teach us a lot of practices that would guide us in helping our patients become well. Next slide, please. So we are, after understanding what is unalome, what is the current healthcare system in the Philippines? Next, please. So once upon a time, there was a certain fisherman. Let's say, for example, the name of that fisherman is Fisherman Paulo. Okay, next slide, please. And He is known to be very diligent. He's able. Next slide, please. Yeah, as diligent as fisherman Paulo, earning his daily living, until one day he realized there was a person drowning. It was a child. So, ang likas na matulungin na Dr. Paulo would save the child and then do necessary procedures as basic CPR. And then he brought the patient to the nearest health center, to the nearest hospital, and he was able to make that patient survive. However, the next day, another child was there. Another child was there. Another child was there also drowning. Paano na yung trabaho ko as a fisherman? Wala na ba akong gagawin kung hindi nagliligtas na lang ng isang may sakit? So what he did is to organize with the barangay, with the municipal, with the city hall. How is it possible to create a health center and bombard it with a lot of necessary healthcare workers and the infrastructure to that? Next slide. So after all these things, sa araw-araw na ginawa ng Diyos, palagi merong nakakasakit, merong nalulunod. Next. We now came out with these issues that we are always encountering. In all government hospitals, makikita nyo, hirap ang, kahit na even before the pandemic, ang dami nating mga pasyente, and do we have the adequate healthcare facilities? So the question now is, what is your strategy? If you're now the clinic director of your own clinic, or just a simple clinic, or a big hospital as where you are right now. So would you be able now to check out how these patients would get well? Next, please. So itong ideal. If you would see the private hospitals, the likes of St. Luke's, Makati Med, Asian Hospital, the ST Hospital, the St. FEU, magaganda yung mga hospital na yan, and they're well adequately supported because mayaman sila. Pero ang Pilipino, which is how much in the demography are in the CDE sector, would be able to afford the services of such good hospitals. Next slide, please. Tapos so kung meron tayo mga as good hospital as a, just like in the US, meron yung USS Mercy, then nagpo-provide ng locations in the whole archipelago of the Philippines, sana all. Ang problema, it is not like that. Next slide, please. So, pag sinabi niyong magandang facility, siyempre merong infrastructure, merong beds. Pero it doesn't stop there. Meron siyempre yung manpower. Pag sinabihin nyo may manpower, next would be a lot of financial resources. Kaya ba natin yan? Kaya the strategy now that I'm going to refer to you is, kapag private ka, you can be on your own. Pero Hospital ng Maynila, all the government hospitals would have a different strategy to this. Next slide, please. So in the Department of Health, alam na natin to enumerate, would that hospital be able to cater to the all stages of life, from pregnancy, newborn, infant, child, adolescent, adults, and the elderly, where it break it down into communicable diseases, non-communicable, along with malnutrition. A while ago, we were talking about sa liver diseases would be obesity, which is also a part of malnutrition, and then diseases of rapid urbanization and industrialization. And part of it now, so next slide, please, will also show all the different diseases that we're handling now. From the communicable HIV, AIDS, TB, malaria, right now we have the COVID, we have the dengue, we have all these monkeypox issues. Non-communicable is the double burden of our healthcare system. Mayroon na tayo mga communicable diseases, mayroon din tayo mga cancer, diabetes, heart attack, okay, along with our malnutrition and lifestyle related. Diseases of rapid urbanization would be injuries, marami ng traffic, marami ng mga substance abuse, mental illness, pandemic travel, and all these climate changes. Next slide, please. Kaya ba natin to? So, let's go back to the issue of Fisherman Paulo, na araw-araw na lang ginagawa yan. He got an insight. Bakit nga ba maraming nalulunod dito sa lugar na to? And what he did was to go upstream only to realize meron palang sirang bridge along the way. the challenge here is fix the bridge so that there will be not more patients coming in. Preventive is better than cure. Ika nga. Pero bakit hindi nagagawa yan? So let me leave the socio-political aspects away. Let us focus as doctors to handle the situation. Next slide, please. So the solution to it would be, next slide, please. Prevent sickness and maintain wellness. Next slide. So we have been discussing about introducing preventive medicine, aiming for wellness. Now let me show you, is there a trend? You would like to establish a food, anong retirement business would you like to get after medicine? So would you like to invest on the food chain? Kung ano meron sa US, sa Europe, sa Australia, sa Germany, nagkakaroon sa Pilipinas. So what is that trend going on regarding wellness? Next, please. This is the geography of wellness. You can see that of the highest would be Asia Pacific. There's a lot of demand for wellness right now. So with this wellness market, quite high. I will not go much into the figures, but showing you kung saan malalaki ngayon. North America, if we have McDonald's, Philippines follow. So kung ganyan ang trend ngayon ng US, probably Philippines will follow suit. Along with Latin America, Caribbean, we have Europe, we have Sub-Saharan Africa, and the Middle East. Next slide, please. Would you now, to the doctors I'm talking to right now, would you like to invest into a wellness along with your Western medicine approach to your patient? And this is the average annual growth. Take note, 2017, 2019, 2020. And the rank as of now is of course the US kasi mahal ang mga products nila. Pero of all of it, the average annual growth rate are maybe negative for these pandemic issues, but definitely starting beyond that, it is on the positive scale. Next slide, please. So this is what the factors would like to come in. So tayo, doktor tayo sana tayo mag-i-invest ng ating additional business component. So doktor na tayo, would you like to go into personal care and beauty? Big money ba yan? Yes, actually the studies show it's quite big. Healthy eating, nutrition, and weight loss. The topic by Dr. Wang a while ago is a challenge. How would you motivate the patient to lose weight? I'm happy with his last slide na treadmill, nag-stepper, pero hindi naman inaapakan. So how do we motivate us doctors and then motivating our patients? Physical activity, wellness tourism, traditional and complementary medicine, which I represent primarily, public health prevention and personalized medicine, which also has to represent when I was with the Department of Health, wellness real estate. Kung mayaman si papa, mayaman si mama. Let's motivate them to go into wellness real estate, mental wellness, the spa, workplace wellness, which is why we have the clinic in this hospital in Maynila to have a approach to our employees to thermal mineral springs would be an asset. Next slide. So let me focus on the highlighted ones. Healthy eating, nutrition, weight loss, traditional complementary medicine, public health, mental wellness, and workplace. Next. So next, please. Would you like to get into this business? Healthy eating, healthy labeled foods and beverages, vitamins and supplements, weight loss, products and services. Next slide. And if this is really the future, looking at medical tourism as part of it, this is in it. Public health prevention and personalized medicine. Next, you would see it's pandemic and future winner. So ibig sabihin doon pa, mataas ang demand, how much more beyond 2022? Mental wellness is also important. You have to introduce senses, the spaces, the sleep, brain-boosting nutraceuticals, and self-improvement. Next. Next slide also shows workplace wellness. It is a pandemic loser. But definitely, 2022, we would see the boom until 2027, where it will reach full bloom. So if you would like to go into studying first before getting into this endeavor, then this is the right time. 2022 is the right time. By the time we reach 2023 and 2027 onwards, you are in place. So workplace wellness for chronic diseases, work-related injuries and illnesses, work-related stresses, and employee disengagement. Next slide, please. So this is where traditional complementary medicine comes in. It's a pandemic loser for now, but again, I would see the future. And hold on for those who are listening still now, hold on, because we will teach you today simple acupressure technique that focus on the bioelectric of the body, which will tell you how's the liver, how's the intestines, how's the brain, how's the heart. We have a simple technique that we will discuss later, known as the ASHI Acupoint Diagnosis, and you will learn it today. Next slide, please. So, another pandemic loser, but a future winner is physical activity. If you would see anong benta ng mga department stores ngayon is focused more on recreational sports, also yoga at home, sports apparel, and fitness technology. Of course, we are now looking at Zumba and yoga online, that is workouts via digital platform. Next slide, please. So we have the wellness tourism, pandemic loser now, nobody wants to travel, but now they're starting to open up. Future winner for international and domestic tourists, wherein traveler would like to maintain good health and their wellness lifestyle during the trip. Next slide. Personal care, sinabi ko na kanina, pandemic loser, kasi sino mag-i-invest ng lipstick? Naka-face mask tayo ngayon. Unless you want to invest on your eyebrow, kasi yun lang nakikita pag naka-face mask. I remember sa operating room during my training years, pag yung mga nurses, yung mga doktora doon, pagandahan ng mata kasi yun lang nakikita beyond the face mask. Next slide, please. And wellness real estate. We would like to invest on it now, development of it here in the Philippines or even abroad. Next slide. So, the spa, hotel, resort spa are usually the big movers to this. And day club, salon, spa, marami nagsara. Pandemic losers. Pero definitely, the prediction, it will rise up. Next slide, please. So, mineral spring, big money involved, but in China, in Japan, in Germany, but the Baden-Baden place, para bang meron tayong pansol, that would be a good motivation for us to get into hot springs. Next slide. So this one only shows the trend. By 2020 to 2025, there will be a big trend towards the following. So wellness tourism would be number one there, and onwards. Next slide. So this one is a pictogram showing personal care. Among the listeners right now, which one would you pick up? In addition to your Western medicine specialization, would you like to get into healthy eating and nutrition? Next in the graph would be physical activity, followed by wellness tourism, followed by traditional medicine, followed by public health, wellness real estate, and then mental wellness, among the two other ones. Next slide. So the projection is stated. The picture speaks for itself. Next slide, please. So pandemic, just to show which one has pandemic and future winners, pandemic losers, and winners the same. Next slide. So we are now going to the community-based early diagnosis and acupuncture. So next slide, please. Okay, I'll give you 30 seconds. Please write this down in a piece of paper beside you. 30 seconds, please. Lungs, brain, heart, large intestine. By the way, heart is divided into two. The functional heart, which is also the brain, and the organic heart, which in Chinese medicine is known as pericardium. Large intestine, urinary bladder, kidneys, stomach, spleen, pancreas, liver, and gallbladder. So if we are having a patient with joint management with Dr. Stephen Wong, Dr. Wong and I would be able to diagnose the status of the liver before the ALT, AST would show abnormality. Ang maganda niyan, medyo well pa ang tao bago mag-deteriorate to a fibrotic state, to a hepatocellular carcinoma. Uunahan natin and tell the patient, you need to change your lifestyle as early as now. Why would I do that? Oh, how come that is painful compared with the rest of the points? Next slide, please. So here, you have written down, ang advice ko lang po, sulatan nyo lang, ikutan nyo. So this is what I would guide you. Can we do a video out of it, please? Yes. I've been telling all my, by the way, look at my clinic. My clinic is al fresco. Even during the pandemic days, my clinic is open. Thumbs up, thumbs down. Right over left. Palms facing each other, fingers locked. Pull, rotate, extend. Pull, rotate. Importanteng rotate. Lift up. And once you've done that, compare which one is painful. Is it the right or the left? Were you able to extend it 180 degrees or 90 degrees lang? Don't despair. Please go on by exercising it every day, and it will straighten up from a 90 degrees to 100 degrees. Let's now go for the other hand, please. So whether you did the right or the left, stretch, pull, rotate, lift up, pull, rotate, extend, pull, rotate, and then pull it, stretch. Question. Alin ang mas masakit? Is it the right over left or the left over right? So which of those checklists you need to circle and indicate whether it's the right or the left? Next slide, please. Next. Yes, so this is the another picture for you to be guided. Take note of the rotate. The one in the center. Rotate outwards and then stretch out, pull in, rotate inwards. Some of you had committed the mistake of not rotating it kaya hindi niya maitaas. So I've learned this before from a certain Chinese guy, and I've modified it to include the lifting up of the shoulders. Question. If you have angina pectoris, where is the pain? All of us know it's on the chest or on the left. If I ask them, why is it on the left? Western trained doctors can only explain the PMI is on the left, but the base is on the center. What we're trying to do is to come out with a statement that the right over left thing represents the right side of the heart, which we all know represents the pumping of the blood to the lungs. If you have bronchial asthma, now or before, you have weak lungs, as we all know in tuberculosis, or you plainly lack exercise, especially during this pandemic, you're going to have a hard time stretching it. It's the issue of organic organs itself, and affecting the meridians or the chi that is preventing you from stretching it, affecting the musculoskeletal issues. So the yin and yang of musculoskeletal internal organ is represented by this exercise. If you have problems with the left over right, it's a manifestation of the heart pumping to the systemic circulation. These are candidates for hypertension or for things as aortic aneurysm or the generalized issue that we are arteriosclerotic cardiovascular diseases. So, sabi nyo, wala, nagpa-check up ako, executive check-up, normal naman. Bakit masakit? So, wag na natin unahin. You would find people in Luneta, especially before the pandemic, you find a lot of those guys in Luneta doing exercises as Tai Chi, even Zumba, as what you see, even ballroom dancing, galaw, 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 you need to open up the joints. So, which of the checklists we would circle now? It's the heart and the lungs. If you're having problems with it, please, in the checklist, circle the heart and the lungs together. Next slide, please. So later on, we will discuss matching with this lifestyle, with this lifestyle with our function. So there is this issue for the lungs. In addition to the thumbs up, thumbs down exercise, feel your clavicle and press on that point. I need my doctors beside me because I need to do acupressure. For all of you right now, feel your clavicle and try now to press on that subcostal areas during the cleavage of your deltoid muscle. So it's not really mid-clavicular, it's a little bit lateral to the mid-clavicular. And start pressing on it. That is the lung 1 point. If it's painful, then that is significant of the lungs. How do we set up? How do we video? Alright. We are good thing with the technical people here. We will now be able to do acupressure. So I was telling you. Yes. So you can stay at the back of the patient. And this is the clavicle. This is the deltoid, the delta 1, 2, and 3. So this is the curved delta. Can you feel? Ayaw mo yun? Okay. So here, do your pressure here. Giselle, tama ba? Melay. Dr. Melay, alin mas masakit? Is it the right or the left?
Yung right.
Okay, right side. So, mas challenge ngayon ang right side of the lungs. I'm not telling Dr. Melay that she has problems with the lungs. No, I'm just telling her that it is the electrical impulses tells you that it is challenge. What good thing about acupressure? It is diagnostic and therapeutic at the same time. So this goes for other points pa. Anong plano natin gawin? Shall we project the PowerPoint? Does this one together? Para yung demo, video demo. Can we do it? So, illustration plus actual demo. So, lung point. There are a lot of lung points in our anatomy. So, in Chinese medicine, it will start as lung 1. It will end up somewhere here sa dulo. So, it passes through the arm. Kaya nga, yung testing natin, na masakit ang right over left, when we were doing it. By the way, I was like this before. So don't despair. I was like this before. Inaraw-araw ko, I was able to extend it already. So kung sakaling kakapitan ako na unod ng mga sakit sa baga, sakit sa puso, at least madidelay ko. Yun ang dilema ng isang doktor. Nasisirang ating pagka-doktor pag tayo ay nagiging paggagamot na hindi natin matreat ang sarili nating sakit. So next slide please. Now we have the heart. Pero hindi ko na ituturo ito. Yun na lang, thumbs up, thumbs down ang ginawa natin is a representation of the heart or the brain. Next slide. And the same thing goes for the organic heart, which is the pericardium. Did you circle your checklist? Next slide, please. Large intestine. The point is found here. So, ito yun. When you adapt the first and the second fingers, I'm now pressing on this is the first digit, second digit. This is the first carpal, second metacarpal. Its uses somewhere on the wrist. So if I try to find a pressure point between it, a soft tissue, that is known as large intestine side, particularly large intestine 4. So I'm going to press here to Dr. Belay, right and left. Meron? Wala. Compared with the lung point. Okay, there's more on the left side. So what does this represent? Large intestine, mamaya, I will discuss the lifestyle. What is a Dr. Belay that's making that electrical impulses firing more than the rest? In my class with them sa PGMI discussions, lumalabas na talagang may mga lifestyle, magka-classmate niya, pare-pareho ng lifestyle, kumakain, natutulog, kaya nakikita natin isang sakit ng mga interns natin ngayon. Next slide, please. So after the lungs and large intestine and the heart, we are now going to see, next slide, please, urinary bladder. Oops. So mahirap pakita kasi bababa tayo. Ganito na lang. Salatin ninyo inyong alak-alakan. You're in your sitting position right now, all of you viewing it, feel the popliteal line. You can press on both popliteal line from the right and the left and tell me, in the very center of the popliteal line, there's a tendon. Actually, it's a tendon of the gastrocnemius muscle. Pero let's say it's the very center of the popliteal line. Press on it. You are now underneath. Nakaupo kayo. Press it. Masakit ba? Pag masakit, have a circle on the urinary bladder. I will tell you later why that is painful. Next slide, please. So, kidneys also. Pag D4 po kayo, pag nag-D4 kayo, feel your medial malleolus. And connect the medial malleolus with the Achilles heel. In the very center of that is the kidney point. I'll tell you later why that point is painful sa healthy lifestyle checklist natin. And please compare also the right with the left. Next slide, please. Stomach. Now, this point is quite challenging because you need to feel your patella. So, hang your heel of your thumb, so your palm on the patella, and you would notice that the tip of your fingers is now on the tibial bone. Slide it laterally, and if you tap your toes, you will feel there's a muscle bulging. Therefore, for those reviewing for the PLE licensure exam, that is the tibialis anterior muscle. And if you press on that regularly, tell me, is it painful or not? Try it. Which one is painful? Is it the right or the left? Pag tama ang pressure ninyo, gagapang yung kuryente or the meridian or the chi or the energy flow, aabot hanggang sa paa. Pag masakit, circle. Pag wala, then let's go to the next point. Next slide, please. Spleen pancreas. So, this is a topic na specialist ng mga family med, ng mga internists, si Dr. Alisa sa kanyang diabetic patients. Why? You press on that, mag-D4 uli kayo, and feel your medial malleolus. 4 finger breadths proximal, papunta sa tuhod. 4 finger breadths proximal to that. And you feel there's a between the tibia and the fibula, therefore interosseous, soft tissue, press on it. Mamaya, magandang point din sa crisis, sa seasonal diseases natin as dengue. I will tell you later. So, just press on it. Masakit o hindi? Right or left? Next slide, please. Liver. The topic of Dr. Wang a while ago. Kung meron tayo sa kamay, meron din sa paa. So look at the first and second toe, and if you trace it, you're now in the metatarsal, first and second metatarsal, before it fuses, in the very center of it, the letter V, soft tissue, that is the point for the liver. So bago tumaas ang ALT, bago tumaas yan, electrical impulses muna, feel that, and see whether masakit o hindi. Next slide. Last point would be gallbladder. But the better way to look for gallbladder is the shoulders. So, Dora, can I ask you to face this at the back? Para makita yung yes. Good. So, kita ba? So here we have the point for the gallbladder is the shoulder. In medicine, we already learned referred point. Alam natin the shoulder represents the gallbladder, di ba? So it's the same as Oriental medicine. Feel your C7 nuchal protuberance, feel your acromion process, imaginary line, midway between the two, this is the point. So both ways, you press like this. Masakit? Hindi. Okay, kaliwa o kanan? Okay, mas masakit daw ang kaliwa. So for her, si-circlean yung gallbladder on the left side. So here. And after pressing it, it's therapeutic and diagnostic relating to the issue of the gallbladder. The electrical impulses of the gallbladder, the contraction of the bile every time you eat your meals. Sa araw-araw na ginawa ng Diyos, walang ginawa kundi kumakain ng tapsilog, ng mga samyupsal, at saka yan. Ako, guilty. All of us naman. Okay, so that's it. Now, let's now discuss why those points are painful. Thank you, Dr. Next slide, please. So, after enumerating all of it, the point on the back is also important. Sabi ng matatanda, ay naku, meron kang lamig. Anong scientific basis naman yan? So, if they were able to discover that certain levels of the vertebra from the thoracic, lumbar, and sacral is thoracic 3, thoracic 5, thoracic 9, thoracic 11, L2, all of it represents organs. So if you can have a quick shot of this, we did your own files now, it will guide you that the location and the organ is diagnostic. I have a patient who are security guard, palaging complaining of middle back pain. Only to realize that when they press also on the stomach 36 point sa legs, masakit din. Therefore, the stomach point, which is located at thoracic 12, is significant for stomach problem kasi mahilig nagiinom ng kape para magising sila sa kanilang walang image daw sa shared screen. Meron ba? Dapat na wala. Alright, next slide please. Buti meron technical team tayo. No? So, na-circulan nyo na ba yan? Next slide. So, let's discuss. Lungs. Next slide. Sige, next slide. Click this. Click. Yeah, go ahead, tapusin mo na. Click. Okay, hold. Isa pa. So, this represents now hika, weak lungs, industrial pollutants, cigarette smokers, medyo masakit ang lung point niyan pag pinipress, and then also kulang sa exercise. Pandemic issues natin, hindi na naglalakad. Aerobic exercise is highly recommended in places there's a lot of trees. Sinasabi ko sa pasyente ko, anong park meron ka pwede puntahan? In Metro Manila, mahirapan kung saan. So, brisk walking for 30 minutes initially. Alam natin, di ba yung walking of 10,000 steps? That is equivalent to around 1 hour leisure walk. Sana magawa natin yan in plenty of trees. Isotonic exercise is better than isometric. So yung mga weightlifting is a good exercise pero mas maganda pa rin ang isotonic exercise. So walking, aerobic, swimming, kung kaya nyo gawin yung mga gymnastics, congratulations. We don't have much time but I can explain to you more details about the exercises probably in another event. So do your deep breathing in areas where there's lots of trees. Ang kliniko, al fresco, a lot of plants in the balcony at mapasok yun habang nagtitreat ako. The patient realizes how good they feel immediately habang nandun pa, immediately after the treatment. Next slide, please. It's even claimed that if you are in an air-controlled room, the virus stays longer for 1 month. But if you are in a alfresco style of restaurant or your clinic, then it only stays for 1 day. So hindi nag-accumulate yung viral load. Okay, next slide, please. The heart, which is also the brain, mga stressed people. Marami ako nakikita dyan, especially to our interns. Ewan ko kung bakit, kundi pinapahirapan ba namin sila, kaya na-stress mentally, o kaya kulang lang talaga sa physical exercises. Next slide. The same thing goes for the pericardium. Pareho naman yan. Next slide. So, next slide, please. We are rushing on time. Next, please. Large intestine. So, kadalasan, and I've seen this among the medical interns natin, since pareho sila ng kinakainan dito sa harap ng hospital, kadalasan kulang sa gulay. Mahilig sa fish, chicken, beef, and pork. So those culprit is causing the bowels to become very, pag dumudumi tayo, ang checklist ko sa mga pasyente, your feces every day, and you have to check it out. Your feces should be big, should be 3 or 4 finger breadths, not 1 finger breadth, and it should float. And then, pag finlash ninyo, it should not have skid marks on the toilet bowl. Meaning, if it is so sticky, the return flow of water from the portal circulation will absorb it back. Lahat ng baho, hihigupin yan. The next organ in portal circulation that it will go to would be the liver. So we're talking this a while ago regarding liver problems. How Oriental Lifestyle to help it? Eat a lot of veggies starting now. Lesser ang fish, chicken, beef, and pork. There's a balancing of equation that I tell, pero enough for us to understand. Now, if lumaki tayo na masyado malakas tayo sa fish, chicken, beef, and pork, then I would suggest you prescribe to your patient the generic Psyllium, Psyllium. Prescribe it. I recommend to my patients the sachet, not the capsule. Sachet, dissolve in a glass of warm water. Bago pa lagyan ko ng sachet, I put honey para medyo palatable, and then a lot of it, and shake it immediately and drink it. Or else it will become a gelatin. And ang challenge dyan, if you take psyllium every day, on the 3rd or the 4th day, mapapansin na ninyo, and the patients will tell you, ang utot, mabango, ang amoy ng pupo, mabango. That only shows that nalilinisan na ang intestinal lining natin, that only shows that the portal circulation is clearer, and it will lessen the burden of the intestines to detoxify. Kaya nga sabi daw nila, ang matatanda, amoy lupa. Kasi lahat ng baho, dumadaan na yun, it bombards the liver, it becomes also, kung screen yan, it starts to have a lot of opening, lampas-lampasan na, kaya amoy ng bibig, amoy ng pawis, bumabaho na. Kaya as early as our age now, young age now, by all means, clean your bowels with veggies or the psyllium I am recommending. Next slide, please. So we're also looking into this dietary thing. Small intestines, the absorption, almost the same. Kadalasan, we lack physical stress. Kulang sa exercise of this pandemic. Ang joke ko nga dyan, kumusta ng waistline natin? I think all of us suffering from excessive pandemic waistline. Sana mabalik natin yung nakaraan. Buti pa yung mga ibang, buti pa si Dr. Paulo maganda ang waistline niya Si Dr. Alisa, maganda rin ang waistline. Next slide, please. Triple warming is the hormones. And that is the Sanjiao thing. Hindi ko na tinuro, pero it's somewhere in the dorsal aspect, on the this part of the hand. Okay, so that's enough for the hormones. Next slide, please. The urinary bladder. Ano yung urinary bladder? Ba't masakit yung alak-alakan? It's a manifestation of your reproductive organs. Along, of course, with the urinary bladder and the and of course the kidneys. So I had a patient now who had tatay ng doktor din, who came in because of the urinary incontinence. I'm sorry, urinary retention post-prostatectomy. So naka-catheter na siya para lang makaihi. Hindi pa natatapos ang treatment ko sa kanya. I did acupuncture on that point. And then nag-leak out na raw yung kanyang retained urine, nag-leak out na on the rim of the penis and the catheter area. So tuwan-tuwa sila, it was quite effective, na drain out na, and hoping na talagang, sabi ko nga, with the Unalome understanding the intervention of how we pray on and the patient's reaction to our prayers and our intervention, sana nga po gumaling agad. Next slide, please. Kidneys. Sinong masakit yung inyong bilial malleolus to the Achilles heel? Kadalasan too much intake of salty foods. Mahilig sa mga sausawan, patis, toyo, may asin pa, ayaw na matatabang ang pagkain. Kadalasan masakit po ang kidneys yan, representing the actual kidneys natin. Next slide, please. So the stomach point, yan, next slide shows, mahilig sa soft drinks, mahilig sa kape, mahilig sa alak, mahilig sa smoking. So those having gastritis, okay, for those gastritis issue, you just press on that point, it will regulate the lining of your stomach plus the release of acidity in that area. Plus, of course, emotional inner anger among people who are the achievers. Mga pasyente kong yapis, kadalasan ang stomach point nila affected. Kaya na-stress sila. It results into anxiety. And if you press on that point, it will regulate the anxiety issues based on the question I just read a while ago. Next slide, please. Spleen pancreas. I was talking about Dr. Alisa's expertise, Dr. Paulo, Dr. Robel, would be the issue regarding diabetes. Since it works on the pancreas, both the exocrine and the endocrine issues of the pancreas, you press on that regularly. It will help lower down your blood sugar. I would bring my mom to the province. Hindi umiihi kasi naka-diaper ang mom ko. She's already 97 years old. Naka-diaper na siya. Ayaw niya pa rin uminom ng maraming tubig kasi ayaw niyang mag-bulge yung kanyang diaper. So, ibig sabihin, pagdating namin sa location, ang taas ng kanyang blood sugar. So, I just recommend before you inject the insulin, you hydrate the patient first. Tapos doon, pag malakas din sa kape, sasabihin ng pasyente, hindi naman ako naglalagay ng sugar sa coffee ko. Pero malakas ka pa rin sa caffeinated. The effect of the dehydrating effect of caffeine will cause it to increase. So, next slide please. By the way, it's okay, it's retained. That point also can be good for dengue, hemorrhagic fever. If you want to raise down the platelets, you press on that regularly. I go there to my patient. I had one patient before. Yes, thank you. I had one patient before. I did acupuncture on that point in the hospital. When I left, I asked the patient, do this. Ikaw, kaano ka, kapatid, nanay, you do this to your child. And they start doing acupressure. The next day, the trend. Usually, the trend goes up naman. Pero mas mabilis ang steep of recovery of platelets kapag na-press po yung site na yan. Next slide, please. Liver. So, when you press on that, mahilig sa intake ng fish, chicken, beef, and pork, kasabay ng mga chemicals that would alcoholic may be there unless it's the NA-LFD. So, medications and also that inner anger. By the way, kadalasan yung mga masasakit ang point na yan, palaging may insomnia, especially at 2 in the morning. Next slide, please. Gallbladder. Again, mahilig sa fatty food. Bago mamaga ang gallbladder, resorting to cholecystitis. And then, cholelithiasis happens kapag palaging weak na ang gallbladder to pump the bile inside, it accumulates, it starts to concretize, kaya nagiging bile salts. As early as detecting it, start telling the patient, awat na sa samyupsal, awat na sa mga lechon, bagden, chicharon, sisig, ang sarap pa man din. Kaya yung siyempre mga lechon baka ngayon, na usok-usok yan, or even the chicken that you eat regularly. Sama naman, hirap talaga maging malusog. Next slide, please. So, you press on that or to you and your loved ones too. What we do here at Hospital Maynila, nilalagyan namin ng ventosa on those sites. Para on the sides of the paravertebral, posterior midline, on the paravertebral muscles, we put ventosa to such because it's very good to represent. Kaya nakikita si Michael Phelps and some celebrities as Gwyneth Paltrow, nakikita niyo meron sila mga ventosa marks kasi alam nila nagpapaganda ng dating sports-wise and beauty-wise. Next slide, please. So this is one exercises too that I recommend. Take note. You just sit on your chair, hold on to the chair, and start rocking your body forward, backward. This is good for pelvic organs. Prostate, ovary, uterus, may mga PCOS, may mga colon problems. Do that regularly. Now, you also do another exercise on the side. So left and right, swing on the left and the right. Pero mas maganda, you put your hands on a yabang position. And you will notice there's a change in the stretch of your side muscles, your flank, particularly where your kidneys are located. And of course, your ovary uterus. Pampaalis ng puson, pampaalis ng bilbil. What more can you ask? And then twist, look as far as your eyes would see on the other side and the other side too. But while you're looking at the back, push the knee on the opposite direction. Push, 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 push. And then other side, push, push. You take note that I'm in bare feet. In my clinic, I am bare feet. And there's a reason behind how to energize your brain through that feet. So mga interns studying for the PLA, study with the barefoot. You would see how awake you become. Next slide, please. So, okay, next slide. Yes. So, this is one, breathing. Inhale as deep as you can, hold as long as you can. I teach the interns now to pass the board exam is intelligence, oxygen to the brain. I also tell it prevents senility. So stretch your cervical, do your breathing first. Inhale as deep as you can. Hold it as long as you can. Bring in oxygen to your lungs. Let it push to the brain to prevent senility, to have intelligence, to pass the PLE, to pass the specialty board. Now, while you're doing breathing, stretch your neck as far as it would go backward and touch your chin to the chest. You can simultaneously do inhale and then exhale. While doing that, you also focus on the hip bones. So whenever you're inhaling, kadyot ang puwet sa likod, full dorsal flexion, and then kadyot ang puwet forward. Okay, from the word itself, kadyot, you know what I mean. Forward. So, sasabayan ang neck, wherein your medulla oblongata is being massaged by yourself, being stretched, and then forward. So, there's a lot of yoga practices that is related to this. So, sabayan natin, put your hands to the side, rotate the thumb inward, followed by outward. Sabayan ng the breathing. So, whenever you have the thumb outward, inhale, stretch the neck, kadyot ang puwet sa likod, and then exhale. Flex the neck forward, kadyot forward, and then the hands is there. This is quite quick. Be able to do it as frequent as you can. For the general body mechanism, kaya makikita niyo mga the Chinese, the Japanese, the Korean, they always integrate that in their wellness. At 3 o'clock in the afternoon, sasabihin na employees sa Japan, get out and we will do their exercises. Next, please. Okay, next. So, parting now, we need to attain Unelome. And part of it would be, where do you stand? And I would like to end my talk with this, a little bit of a chapter regarding Ikigai. Next slide. It only shows that you have to ask yourself, next slide, anong galing mo? Let's say, ano yung doktor ka eh. Doktor tayong lahat. So, we studied a lot of it. Kumikita ba tayo dyan? Definitely. Kaya nga tayo nag-aaral eh, para maging professional doctors tayo. Kailangan ba yan sa mundong ibabaw? So, if you correlate what you can be paid for with what the world needs, that's your bukasyon. Pero it also becomes a profession if magaling ka ba talaga mag-doktor? O kaya mag-ano ka na lang, mag-hospital management ka na lang rather than handling clinical patients. But if you're good at it, why not? Pero one issue is, sa ano ang love mo? Pinilit ka lang ba ng tatay, nanay mo mag-doktor? O talagang gusto mo makatulong sa kapwa? And that is where once the inner circle, the blank space over there, is your actually the, next slide, Ikigai. So, we're having said this, I think that's the end of my talk. And if you have any further questions, the wellness industry is focused more on prevention. May pera ba yan? Pero kung walang pera, makikita nyo, global trend is teaching you, may pera talaga dyan starting 2023 and onwards. Good luck to all of us po. Salamat po.
Thank you very much, Doc Al, for a very comprehensive and insightful lecture. So the lecture is very good, no? It encompasses so many things. Dr. Al, you talk about the Buddhist principles and integrating it to the health, the illnesses, and even touching on spirituality. So there was also mention of of course, the traditional Chinese medicine, acupuncture and acupressure, how each acupressure points represents the different organs. So the floor is now open for your questions. I'm sure Doc Al is more than willing to answer all your queries. So I think we have the first question coming from Dr. Salinel. Is medical tourism is here to stay, meaning is it already a future here in the Philippines? What do you think will be the front runner in the wellness program, in fact? Family medicine, lifestyle medicine?
Thank you, Dr. Ray. Especially celebrity doctors as Dr. Salinel, in demand yan sa medical tourism. For the reason that ini-interview siya sa radyo, di-interview sa TV, you can introduce such practices na Oriental and Western together. Mas, sino ba competitor natin sa medical tourism? Number one would have to be Thailand. Medyo pareho tayo ng sistema, they're also into it. Pero if you're going to go to other countries, masyadong mahal. Sabi nga nung isang pasyente na galing US, gusto magpaayos ng cosmetic dentistry, mas maganda umuwi daw sa Pilipinas kasi mura na, kasama ng pamasahe, covered pa, rather than doing it in the US na napakamahal. So, economy-wise, we all know that labor-intensive ang Philippines at doon tayo magaling. In fact, our healthcare providers are of export quality. Proven fact na yan. So, if you go for medical tourism, the trend, the Global Wellness Institute that I've shown you will show from 2023, tourism starts to boom. Proof, kita niyo yung mga restaurants mag-open up na. Marami pang sarado ngayon, pero it starts to open up. Pag yan, bubukas na, bumalik na mga tao, they will now be craving for these wellness issues na makakatulong. Ganito yan, ano po? Maganda ang mga spa establishment. But who are manning it? If you are into the integrative medicine thing, doktor na kayo, saan pupunta ang pasyente? Doon sa may doktor o hindi doktor. Siyempre, ang priority nila would be a doctor kasi alam nila they will be manipulating everything. Ba't ako maghuhubad? Pero if professional naman, definitely it's safe. It's moral. Pero if you now integrate these acupressure techniques, doon pala bakit masakit tong gallbladder issues mo dyan? Kumusta ba ang kain mo? Ayos ba daw kumain na? They would defend it, but of course, a-advise nyo na. So wellness and medical tourism will come together.
Thank you very much, Dr. Al. Okay, a question from Dr. Pinili. Any advice po on dietary recommendations when in patients belonging to the lower social economic class?
Okay, good question po.
Good question po. Are we really seeing the lower ABCDE? Those in the D and the E, are they really malnourished? Probably in the province, yes. But in metro cities, at tataba nila sa squatters area. Dumaan kayo, yung mga nag-adong pedicab kasi ang lifestyle nila pagdating na sa bahay, mahilig din mga rice eater kasi ang Pinoy. Kaya morning, noon, and night, puro kanin tayo. Kaya yung iba, nagle-lessen na ng kanin. Kaso yun ang masarap. Kaso yun, makikita natin, sabaw na lang nung chicken na kinakain ninyo, ulam na yan. Kaya, sir, extra rice pa nga po. Yan ang mga challenge sa atin ngayon. Kaya, if you can have that discipline, then wag na sana po natin, yung sinabi ko mga fish, chicken, beef, and pork. That's good, pero wag po masyado marami, focus tayo sa gulay at saka mga prutas. And if you still cannot help yourself going into that type of diet, you integrate my recommendation of the psyllium product. I've been taking it for the past, I think, 14 years na. Kasi ang challenge ko dyan, gusto ko, sa mga kumakain po dyan ng merienda, ang amoy ng utot, amoy ng pupo, bumabango 3-4 days after taking it. Don't take my word for it, try it yourself.
Okay, thank you very much, Dr. Al. So here's another question from Dr. Isagani Kidilla. I think you mentioned this also a while ago, siguro, for the other participants. Is there any acupressure points for anxiety and depression, Doc Al?
Okay. Good question po. Anxiety is LI4. Let me take note. LI4, ito po yung pinakita ko na kanina, large intestine. It has a sedative effect because it releases endorphins. Plus, it also releases nitric oxide. The two chemicals in our body will give us the happy hormones. It will relax us. At the same time, it will open up our blood vessels to nitric oxide. That would relax a lot. I remember there was a time wherein one of our residents from a duty, pagod na pagod, sakit ng ulo, parang stress na stress siya. And since the residents already trained to it, pinahiga nila sa office yung aming chief resident doon at ginawa nila yung acupressure to those points. LI4 at it relax him a lot. Ngayon, if you want, for those who are mentally alert, pakalmahin nyo muna, let them sleep for a few minutes, let's say mga 30 minutes. Paggising na niya, mas magandang suportahan nyo rin with another acupressure point of stomach 36. Remember the point I told you on the leg, on the tibialis anterior muscle, you press on that, it will wake up the patient. The combination of the two, it will make the doctor more alert and intelligent to hurdle the problem he is encountering the next day.
Very well said. So another question, Doc Al, related with the span, no? You mentioned, Doc Al, how often should we do ventosa cupping?
Itanong nyo kay Michael Phelps. Gano'ng kadalwas siya ginagawa? Almost every time na nagsiswim siya, he's applying it. I'll tell you the scientific basis now. Pero before that, with 23 Olympic gold medals, there could be some proof to that. Now, the scientific base of it is, if you do negative suction effect on the skin, underneath there are blood vessels. Actually, we have mapping. Kapag na-dilate yung skin, on top of it, with the negative pressure, either by the flame or the more modern version of the pump, then the blood vessels underneath starts to open up. Kung blood vessels natin ay parang traffic sa Metro Manila, sa Metro Cebu, sa Metro Davao, then opening up with enhanced good flow. Kaya tama pala sabi ng matatanda, ang ventosa daw is pampaalis ng lamig. In reality, it opens up blood vessels so that magkakaroon ng warmness on the area, it will flush out the lactic acid causing the pains on certain regions of the body. So, if you have access to it, may nabibili naman ngayon, go for the online shopping, may nabibili mga pump na ganyan. Pero, take note, mas maganda po na bantayan nyo kasi ayoko nagkakaroon ng blisters. Sa China, pinapa-blister nila yan. Ano pa yung lancet na ginagamit natin for hemoglobin test? Nilalagay yan. Iba't nila lancet pa, which is so unhygienic. I don't go for wet cupping. It's so grotesque. So for a doctor na medyo may finesse, tama na siguro ang dry cupping. Do it as frequent as you can if you have the access.
Okay, but so if you have the means, no, you can do it every day. Very beneficial. From Dr. Zolio Sabuya, can we use electronic acupuncture pen in lieu of acupuncture needle?
Why not? Kung meron kayo. Pero naging fad yan eh. Even years ago, I think 5-10 years ago, it became a fad. They were buying it at ginagamit. And for those, i-challenge ko lahat ng bumili niyan. Nasa na ngayon? It's left in your drawer, it's left on the shelves. So it's really important that the disciplined person would do it. And the professional doctor, probably you, kapag na-train na kayo in the real sense of acupuncture.
Okay. Thank you, Doc Al. So may question dito, medyo related with the pandemic, Doc Al, no? The role of steam inhalation for COVID patients. What's your opinion on this, Doc Al?
Good question. Hoping pawala na COVID. I just hope we pray na pawala na. Looking at the Spanish flu, after the 3rd year, nawala na. Sana nga ganun din ang ating COVID. Pero if you would see, epidemiologic triangle is my answer to that. Remember our epidemiology? We have the host factor, which is the COVID virus. We have the the causative agent, which is the virus. We have the host factor, yung ating naturaleza, our body defenses, and the environment. So sabi ko kanina regarding my alfresco style of a clinic. You will ask yung mga riders, tanungin mo sa kanila kung nagkaroon sila ng COVID during this pandemic for the past 2 years. They would claim wala nagkaroon sa pandemic sa kanila for 2 reasons. Vitamin D from the sun exposed. And second would be walang aircon obviously. So sa taxi, delikado yan. Hihigupin ng aircon niya, babalik ulit sa driver, babalik sa customer, sa passenger. So that is the 3 epidemiologic factor. Saan papasok ang steam inhalation dyan? To increase your body defenses by enhancing steam inhalation. Alam natin yan, dekahon yan nung when we were studying. All respiratory problems, whether sinusitis, whether it's asthma, you allow, kaya meron yung steamer na ginagawa sa mga pedya, ginagawa natin yan. Pero ngayon, ang pinaka-obvious is the steam inhalation that you can do. I recommend, simple lang, tasa, hot water, minsan I put tea, tapos lalangapin ko. So that's already steam inhalation. It moistens the throat. Once it moistens the throat, it opens up, since it's warm, it opens up the blood vessels, what will enhance flow of your antibodies for the flow of your white blood cells to the site. It will increase it. Parang tinanong mo ko, yung mga vitamins ba na immune enhancing makakatulong? Of course, obviously, alam natin na nakakatulong. The same thing goes for these things that would help. So the epidemiologic triangle, the environmental factor would be steam inhalation. At gawin niyo po yung regularly. Katulad po sabi ko sa labas with the plenty of trees, it will increase your defenses. When my mom and I goes to Quezon, nalalanghap niya yung manahaw air, lumalakas siya. She becomes more talkative. Ibig sabihin, nawawala yung kanyang depression, nawawala yung kanyang senility kapag nakakalanghap ng magandang hangin.
Important pala, Doc Al, no, yung going out on on breaks, no? Going out to the outdoors and having better ventilation will help a lot, no? Not just for COVID. So another interesting question from Dr. Pabon, what are the possible strategies that can be done in order to make the practice of acupuncture an oriental healthy lifestyle, not just for COVID, but also that can make it sustainable in the community setting here in our country, Doc Al?
Yes, so the strategy is using integrative medicine. So all the doctors, all the consultants of Hospital ng Maynila Family Med were already trained in it. So kahit na paano na isasama na nila. I remember si Dr. Paulo, yung father niya, sumakit ang balikat. We did acupressure at the shoulders. At since very mental yung father niya, lawyer kasi, so nakakatulong na we have integration of it. So the strategy would be integrated. Kung anong limitation ng Western medicine, mapupuno ng Oriental. Kung anong limitation ng Oriental medicine, mapupuno ng Western. Plus the fact, the guys na mga matatanda, ayaw masyado na bobombard ang katawan nila with more invasive means of medicine. Alam natin, effective yan. Antibiotics, very effective. All these medications for metabolic disorders, alam natin yan. Pero, as much as possible, if you do acupuncture to a patient, the dosage does not have to be increased. Therefore, the LD50, ED50, if you would remember that, the side effect of it is not attained if you do acupuncture because the uptake is enhanced. Remember, I told you acupuncture opens up blood vessels with the nitric oxide. Then, yung bombardment of blood into the site with all the injected medicines you gave, the ingested medicine you gave, mas ma-absorb ngayon ng katawan. Kaya integration po ang pinakamagandang approach.
So indeed, we are very lucky here at the Hospital ng Maynila, no, for Doc Al for teaching us doctors here, including the interns, no. So we also need to do our part para ma-push natin tong acupuncture and oriental healthy lifestyle. Thank you for that answer, Doc Al. Another interesting question: do you recommend Nestea Cleanse high fiber, Doc Al? I think these are the commercial iced tea with fiber, Doc Al.
Oh, okay.
May picture.
Yes. Matamis ba? Siyempre, kung mga patient yung diabetic at sobrang tamis yan, ililimit na natin. Idadalute nyo lang. Yung nga lang hindi na ganun kasarap pag diluted. Matabang eh. So, this is one of the things that maybe you can work out. Discarte na ng doktor yan pag ibibigyan nyo yan.
Very well said. Doc, I think you have gained some fans. Tinatanong Doc Al yung clinic hours mo at saka kung saan, no? I think there are some doctors who would want to visit you or would refer their patients to you, Doc Al. Can you tell us your clinic schedule?
Ganito na lang po. Turuan ko na lang kayo. So, I teach you how to do acupressure with whatever specialty you have. Right now, I have this classmate of mine She's an OBGYN. She's having a vulvodynia patient, so pain on the vagina area, parang pelvic pain syndrome. So can acupuncture help? She will do everything, screen out everything, baka may mga UTI or what. Then on my side, i-merge namin. Magkikita kami bukas para we share techniques, and pag tinuro ko yung mga acupressure technique, yung turo ko sa inyo at the back of the knee, that is good for pelvic pain syndrome. You try it. Now, kung gusto yung matuto, then you can contact Hospital ng Maynila and we will see what we can do. Kasi pag inorganize na, pag na-lift na ng IATF, na okay na talaga ang face-to-face. Kasi ngayon, even the medical interns, di pa kami fully 100% face-to-face. Pero pag face-to-face na, open na yan, then we will start training doctors in, unahin ko muna mga doktor. Kasi meron tayong differential diagnosis na hindi alam ng mga non-doctors. Lamang tayo doon. And why will I go teaching them anatomy, physiology, differential diagnosis kung kayo alam nyo na mas shorter yung ating training para sa inyo.
Okay, again, for those interested, no, merong you can learn from the best, no. Doc Al will have some scheduled classes for those interested to learn more about Oriental healthy lifestyle and acupuncture, acupressure. Okay, in the interest of time, I think Doc Al was able to answer all your queries. No, indeed, it was a great way to end our last day of postgrad. So I now give you back the floor to our host, Sir MJ.
Thank you so much, Dr. De Castro and Dr. Lagaya. Dr. Lagaya, please remain on cam as we award you your certificate of appreciation. Hospital ng Maynila Medical Center, Department of Family and Community Medicine,